Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and I'm exactly one half of the Bob and Brad team, the better half, if you ask me. Today, we have a real special guest. He is a board-certified neurosurgeon, yes, and he's with Inspired Spine is the best way to get a hold of him. InspiredSpine.com. And he does a new procedure fairly new, and he's done a lot of these as a very non-invasive surgery. So he holds both an MD and a PhD, and he was one of the first 30 surgeons in the United States to perform this groundbreaking surgery. So we'll be talking about all of that. We'll be talking about what patients would benefit from this and whether or not you would qualify for this type of surgery. Dr. Abbasi, thank you so much for coming on our program today.
My pleasure.
We got a lot of subjects to talk about today, a lot of things to go over. So I thought we'd go ahead and get started. Now you have a video out called A Brief Natural History of the Spine.
Yes.
And we'll put a link below. I found that very interesting, talking about the whole process and controlling expectations. Do you want to talk about it at all?
Absolutely. I think, it is, I as a surgeon, I am the last link to change somebody's life who is falling off the cliff.
Right.
And many times, people can avoid falling off the cliff altogether. As a matter of fact, that is what Kayla does for us. They put a healthy lifestyle, protocols, the nutrition, exercises together to change a natural trend of all of us to get old or slow down the aging process of the spine. When I ask people, when is the maximum capacity of the spine? When is the maximum vitality of the spine? Most of my patients tell me when you're into your 20s, because they see most of the athletes in their 20s.
Right.
But if you really want to know when is the maximum capacity of the spine, look at the Olympic gymnast.
Right.
They're between 12
quite
and 15
young.
years old. Yeah, quite young.
Yes.
You need more motor skills. That's why, like football players and so on, they're in their 20s. But after that, we all age. As my father used to tell me when I was a young and pretty unknowledgeable person, and I would tell him he's old, he would tell me, you get to my age if you're lucky.
Yeah, right. Good point.
Because if you're not lucky, you will die young. Our spine will age with us. That's why it's important to have a healthy lifestyle, because you can age fast or slow, but you will age. And Kayla and the IS Life have put good protocols together just by getting exposed to us and knowing simple facts. We can kind of move your aging process, slow it down,
Sure.
and move your curvature of your spine to a more favorable area. Now, sometimes you have a bad luck, you have an accident, you have
Right.
a spondylolisthesis, you have a pathology, then you fall off the cliff.
Right.
That is where I come in, and I reverse that process and bring you back to your age group.
Yeah, people who have back problems understand as well. I mean, you can't do anything. It's the foundation of your body. So,
Yeah.
I mean,
Now, I have myself back pain, so I know how it is when you cannot move an inch.
sure.
Everything
Exactly.
is excruciating. Maybe that's partially give me more empathy for my patient.
That's true. I always think that too.
Yeah.
If nothing else, we get a little more empathy. So what type of patient is a good candidate for OLLIF?
Now, first of all, any patient with a back problem is a good candidate for Inspired Spine, because
Gotcha.
Inspired Spine, we do 5% to 8% surgery. We do over 90% other treatment to
Gotcha.
our patient. But the patient that have been told he needs a spinal fusion, or he cannot be helped. These are our specialty. These are people, elderly people with additional comorbidities, the other problems that other surgeons have told them they cannot help them. That is where we truly shine. And there's not a week where somebody from other states doesn't come to us. Like we had a patient with, who is a Jehovah's Witness who has been told by his fourth surgeon, you will bleed and die on the table because the surgery you need is so bloody, so long, you will not survive that. We did that surgery and our blood loss was half a cup of coffee.
Oh,
and we sent the patient home 2 days later. Or we had a patient who have been told by a panel of 7 surgeons in Cleveland Clinic that you are 500 pounds, your BMI is 62.5, you will die of surgery. You will die on the table.
right.
We did that surgery in 2 hours and 4 minutes.
Wow.
We had 110 cc of blood loss, and we sent that patient out of hospital 2 days later.
My God.
This is our specialty. And this is no magic, except you understand that we don't do the old surgery. We do a different kind of surgery. Like I'm in Alexandria, and you are in close to Rochester.
Right.
If I tell you I can come to you in 1 hour, you would tell me, and if you don't know flying, if you have no concept, you don't understand concept of flying, and I tell you I will be there in 1 hour, you say either I'm lying or I'm a reckless driver.
Right.
But if you know the concept of flying, you know anybody can get in an airplane here
Right.
and be in your place in 1 hour.
Proper technology. Yeah.
Yeah.
So you also mentioned that you did a 93-year-old nun.
Yes.
I wanted to ask about that.
You said your mother is 90-year-old, right?
91. Yes.
91. You're a lucky man to have her.
Yes.
But when people get old, their spine get old, and when bone grinds the bone because the disc is gone, we know how excruciating painful that can be. That doesn't change your life as a patient, but that changes the life of your entire environment. Your family, they quit what they are doing to just make your life possible.
Right.
And this nun, we did years of conservative therapy, but finally she came to a point that she needed 3 people to just help her to get by. We did that surgery. That surgery was in 1.5 hours. We sent her out of the hospital in 3 days. And she came back a year later, and we have a testimonial of that nun who was telling us the only thing she needs help now is to turning a mattress from one side to another.
Oh,
I
my
need help
God.
with that.
Oh,
And don't ask me
crazy.
why she would need to turn the mattress from one side to another.
Right.
But she doesn't need 3 people to just make her life tolerable. She's independent. And that is
Right.
the goal. Our goal is to make people comfortable and independent.
And I don't know where I read it. It was among your materials, but they talk about when the spine becomes so bad, you fall off the cliff and you can no longer ambulate, that, unfortunately the lifespan of people who can't ambulate is greatly shortened, correct?
And what is the most important recommendation for people with heart to keep their heart young?
Keep walking.
Walking and small, frequent exercises.
Yes.
If you quit ambulating, doesn't matter for whatever reason, your prognosis is worse than if you are elderly. Elderly defined these days 75 and above. If you are elderly and you quit walking for no matter what reason, your diagnosis is can be whatever it wants to be. Your prognosis, meaning your expectation, your outcome, is worse than if you get diagnosed with cancer.
Yeah, is that
if you
crazy?
quit walking, your heart, lung, your entire system shuts down, and you cannot take stress anymore if your heart is not constantly exposed to certain level of activity.
Stress, yeah, exactly. So I imagine a lot of, like, I saw it also mentioned farmers and truck drivers, they can get back to work a lot sooner than
Yeah.
if they could even get back to work on an old traditional surgery. So,
Yeah. Now, we have the tremendous amount of data on that. We don't need guessing in that regard. We know that after open surgery, it takes a vast majority of the patient more than 2 days before they can freely ambulate. And that's why they are in the hospital 3 to 5 days. Our patient, vast majority, 96% of them ambulate within the first 24 hours. And that makes sense. They can walk, they can go home. And that propagate as well in the recovery and return to work. Whereas after open surgery, recovery can be 6 to a year project. Our patients return to work mostly within a month or two. So we cut the return to work to 1/3 to 1/4 of what open surgery can do. And that is based on significant amount of data. I want to understand with the patient that what their problems are and what they are doing. Sometimes they have to reduce their activities. Like, I don't anybody to start climbing trees after a surgery, after any kind of surgeries.
Right.
But our surgery has shown to be the fastest way to put the patient on the recovery back, to get back on the golf course, to get back to their life, family life, sexual activity, and all those things that can be demanding to the spine.
So we kind of talked about this a little bit, but it sounds like you will take patients from anywhere, correct? I mean, you can take them from other states, and you can
take them from other countries.
Other countries, sure. Insurance tends to pay for this or not?
Well, insurances has never given us a problem. And as a matter of fact, when we went, this is a true story. We showed our result to Blue Cross Blue Shield of Minnesota. The vice president of the physician relationship, after he looked at our data, these are people who understand data.
Right, exactly.
He stopped the spine surgery on his mother-in-law, which was scheduled for the next week after that. They stopped that and they sent her to us for us to do the surgery.
I completely understand that. Like I said, I have some regrets myself here. So can a patient, a possible patient that needs surgery, can they talk to former patients who have had the surgery? Is that allowed, or do you have?
Absolutely. We call this patient ambassadorship, meaning that many of our patients are so impressed with us that they ask us how they can help, because these are patients that are told there's no choice, there's no hope, there is no procedure for them. Once they get back to their lives, and we have 1,000 testimonials online. Every surgeon can put 2 good results out there, but we have thousands of testimonials at different stages, and many of these patients, not only they send their family back to us, but as well they want to tell other patients that there is a hope there. So we call that patient ambassadorship. As a matter of fact, Kayla is the person who connect those people who want to talk to somebody. But as well, we have tons of testimonials online.
You want to talk about the sacroiliac joint and the procedures that you have for women quite often.
Yeah. Now, sacroiliac joint is where the spine and the pelvis are joining. We call it a joint, but in truth, it's not a joint. It shouldn't really move. And the only time in a human life it moves is when a woman is giving birth. It opens up the pelvis for the baby to pass through. For 70 years, we have neglected the sacroiliac joint. Many times, as a matter of fact, 1/4 of the time, from 4 people who come for the back pain to spine surgeon, one of them is not the spine the problem, it's the sacroiliac joint the problem. And the spine surgeon does the right thing, look at the spine and say, you have no problem, go away. Because if he's not trained to as well treat the sacroiliac joint, he won't look in the right places. And we have found that tremendous number of the people, especially younger women, who have back problem, and they go to a spine surgeon and they're sent back and they're miserable for years. They come to us, we figure out it's not the spine, it's the sacroiliac joint, and we do a half-an-hour surgery, and they truly regain their lives. This has been, in my lifetime, one of the most miraculous things for people who have undiagnosed, untreatable, unsatisfied spine situation, we just have to look more carefully and find out the problem is not the spine. The problem is sacroiliac joint. That is important enough that I'm willing and I'm happy actually to come back on your show. Talk just about the sacroiliac joint.
Yeah,
because,
I think that'd be well worthwhile. And
yeah.
Because I'd like to know how it presents itself and all that. I mean, all
Absolutely.
the details on it. So we are running out of time here. So I wanted to be respectful of your time. So Dr. Abbasi, thank you so much. I'd love to have you on again, or anybody within your organization, if there's anything they want to talk about, we could do that. So
absolutely, my pleasure. I have made my life about teaching and public education.
I could see
and
that.
I'm happy to be back anytime. And I thank you for the opportunity to bring the message to the broader public.
The thanks all goes our way to you.